This is an example of a prolotherapy session on a patient's neck who's had some whiplash and some ligament and tendon damage through the cervical joints and up into the attachment points along the base of the skull. What you're seeing right now is injections into what's called the nuchal line. And the nuchal line runs along the base of the skull, and it's where the majority of the muscles of the neck, as they come in and attach to the head, that's where a lot of the attachment points are. So it's very much like if you're holding a bowling ball in your hand and you see where your fingers are attaching along to the bowling ball. That's very much like the muscles coming in and attaching to the base of the skull there. So that's a really common spot for people to have tendon damage from whiplash injuries or from, let's say, constant wear and tear stressors, sports injuries like big hits to the boards in hockey, or football traumas as well too. So that area there is working mostly on tendon type of tissues. What we're about to see right now is working on the ligaments of the facet joints of the cervical spine. So we have 7 cervical vertebrae. C1 and C2 are really off limits for prolotherapy for the most part. So what you're seeing here at the beginning of this view is the 3rd cervical facet, both on the left side and on the right side. And the facet joints, what they do is they give a great deal of integrity to the stability of the vertebrae. So C3 attaching to C4, C4 attaching to C5, and keeping those cervical vertebrae in their normal range of motion, and basically preventing excess motion and excess wear and tear from bones grinding together with that type of excess motion. With prolotherapy, our main goal here with the facet joints and with the ligaments is to regrow that integrity so that the ligaments are doing their job, and now the muscles of the neck don't have to guard. They don't have to grip. The nervous system does not like unstable ligaments, and muscles guard when the ligaments are unstable. So this is an example of a prolotherapy session treating somebody's cervical spine.